Hello, we are Group 28, and we are Anita, Ivy, Benhan, Katie, Derek, and Michael. We are now discussing the drug therapy for Vorinostat. By the end of this video, we hope you will be able to learn both brand and generic names of the drug, understand the approval and uses of Vorinostat, thoroughly understand the drug's mechanism of action, common adverse effects, and drug interaction. Also be able to discuss Vorinostat pharmacokinetics properties, and finally be able to discuss any mechanisms of drug resistance. So first thing to begin with, the brand name for Vorinostat is Zolinza. The drug is available in one strain only, 100 mg capsules, as shown in the image on the top. Patients receiving this medication will often take 400 mg orally once daily with food, or if intolerant, the dose will be reduced to 300 mg orally once daily with food. Further dose reductions may be necessary.
Moving on to the chemical structure. Vorinostat is a synthetic hydroxamic acid derivative with anti-neoplastic activity. The drug functions by binding to the catalytic domain of the histone deacetylases, leading to inhibiting deacetylation and leading to an accumulation of both hyperacetylated histones. It also induces apoptosis and sensitizes tumor cells to cell death processes. The drug can cross the blood-brain barrier. A little overview of Vorinostat's approval and use. The drug received approval from the U.S. Food and Drug Administration on October 6, 2006. The drug is classified as a histone deacetylase inhibitor and was approved for use in the treatment of cutaneous manifestations of cutaneous T-cell lymphoma, otherwise known as CTCL, in patients with progressive, persistent, or recurrent disease on or following 2 systemic therapies.
The next topic to discuss is the pharmacokinetic features of Vorinostat. First, absorption. The drug is orally administered with a high-fat meal. Administration like this causes a 33% increase in extent of absorption, but tends to decrease the rate, resulting in a 2.5-hour delay. Distribution. 71% of the drug is bound to plasma proteins. Metabolism. The drug undergoes glucuronidation and hydrolysis, followed by beta oxidation. Metabolism results in 2 inactive metabolites. They are O-glucuronide metabolite of Vorinostat and 4-anilino-4-oxobutanoic acid. No cytochrome P450 involvement, so drug-drug interactions seen with many other medications are not found with Vorinostat. Excretion. The majority of the drug is eliminated by way of metabolism, while only a minor portion, around less than 1%, is eliminated unchanged in the urine.
Now we'll be discussing the mechanism of anti-cancer action. Vorinostat exerts a cytotoxic effect via the inhibition of histone deacetylase, often referred to by the abbreviation HDAC. Histone deacetylases play a key role in DNA regulation by removing acetyl groups from the DNA packaging proteins known as histones. Continuing our discussion of the mechanism of action, removal of acetyl groups from histones is significant as it increases the positive charge of the histone, which more strongly attracts the negatively charged phosphates of the DNA backbone, thus allows for a tight packaging of DNA into chromatin. Additionally, HDAC regulates various transcription factors via its ability to remove acetyl groups. Therefore, by inhibiting HDAC, Vorinostat use leads to the alteration of chromatin packaging and decreased transcription factor activation, which halts cell growth and ultimately leads to cell death.
Now to discuss about the dosing and administration. This medication should be taken with food, and Vorinostat is a bad absorption when you take with the high-fat meal. The capsule should not be chewed or be broken. For the dosing, the recommendation dose is 400 mg oral, one daily with food. For the patient who cannot intolerant to the therapy, will require the dose reduction, 300 mg oral, one daily with food.
Now to discuss Voriноstat's adverse effects. The most common adverse effects are of the gastrointestinal variety, occurring in 20% or more of patients. They include diarrhea, fatigue, nausea, thrombocytopenia, anorexia, and dysgeusia, dry mouth, and more. Dysgeusia is an impairment in the sense of taste. Both thrombocytopenia and anorexia are thought to be dose-related, so dose adjustment or discontinuation of therapy may be necessary. GI disturbances, if significant, may require antiemetics, antidiarrheals, and fluid or electrolyte replacement to prevent dehydration. In addition to these adverse effects, Vorinostat has been known to cause thromboembolism, hyperglycemia, QT prolongation, and fetal harm. Thromboembolism, specifically pulmonary embolism or deep vein thrombosis, is possible. Patients should be told to monitor themselves for signs and symptoms. Hyperglycemia, which can be remedied with changes in diet or even drug therapy. QT prolongation, which requires monitoring of electrolytes and baseline or periodic ECGs while on the treatment. Lastly, Vorinostat can harm a fetus. Therefore, pregnant women needing to take this therapy should be warned and counseled properly. Now to speak about drug interactions. Vorinostat has a couple of drug-drug interactions. These interactions occur when used concomitantly with Vorinostat. The first being with coumarin-derived anticoagulants like warfarin. Use of Vorinostat and warfarin is associated with prolonged thrombin time and elevations in INR. As a result, it's necessary that both prothrombin time and INR to be monitored regularly by their physician. The second major drug interaction seen is with the use of other HDAC inhibitors like valproic acid. Combined use of Vorinostat may lead to more severe thrombocytopenia and gastrointestinal bleeding. Patients receiving both medications should have their platelet count monitored.
Now we will discuss the mechanisms of resistance to the HDAC inhibitor Vorinostat. There are multiple mechanisms of resistance, the first being an increase in the HDCA substrate where Vorinostat binds. This will make it more challenging for Vorinostat to bind to all HDCA substrates without an increase in dose. Next is a change in the molecular pattern on the cancer cells, which makes binding of the drug not possible. Last is the upregulation of UPR, or unfolded protein response, which will increase the pro-survival genes that induce autophagy. This prevents the cell from going through apoptosis or cell death. Now we'll talk about monitoring. While taking this medication, the patient should be monitored regularly. Monitoring includes blood and chemistry tests, monitoring for electrolytes, glucose, and serum creatinine, monitoring the hepatic function, INR, fluid status, and other signs and symptoms of thromboembolism. Thank you guys for watching. We hope that after watching our video, you will better understand the drug Vorinostat. And again, thank you for watching. And here are references, mainly the Vorinostat package insert, the FDA approval, and random articles.